same thing is true with blood pressure. You take a drug to lower your blood pressure. Now, you guys know the systolic blood pressure is the first number, right? When the heart squeezes and explodes like a cannon, shooting the blood out to to your toes and to your brain, that's the systolic blood pressure. That's the first number. Under all that pressure of the heart pressing against that blood, shoot out to your whole body. Now, what's the diastolic blood pressure mean? What's the second number? Well, the blood vessels are supposed to be elastic, just like one of those balloons that a clown can tie up into like a little animal or something. You can blow up this balloon, so the balloon goes in and out. So as the heart goes in and out, as the heart pumps and squeezes in, now the blood vessels distend under pressure. They're elastic, they distend, so the blood pressure doesn't get too high. If it was narrow and stiff like a pipe, like an iron pipe, which when the heart exploded, the blood going to the brain would destroy brain cells, so the blood pressure would be too high. Going to the kidney would cause kidney cells. So the blood vessels in the periphery expand to make the pressure be lower, and then how does the blood get back from the brain and from the legs and get back to the heart? There's no second heart in your feet. How does the heart get back again? The blood vessels are your second heart. They're elastic. They expand and they contract. The contraction, the elasticity, the movement of the blood vessel wall pushes the blood back to your heart again. And when does the coronary arteries refill with blood? During systole when the heart squeezes out, or during diastole when the heart's relaxing and refilling? The coronary arteries, the blood vessels that go into the heart muscle itself, are filling with blood during diastole. When the peripheral vessels are contracting back in during diastole. Why am I telling you all this? Why? No, I'm telling you about this because if you take a blood pressure medication, which to lower your systolic blood pressure, it's going to artificially push diastole down, so the blood's not going to come back to the heart fully during diastole. Because the amount of diastole you have is the pressure that's high enough that your body needs to get the oxygen back to the heart again, because if your blood vessels are stiff, it needs to get that pressure higher to get the blood vessel back there. So when you take blood pressure medications that lowers your systolic blood pressure to save brain cells and save your kidney, you're doing it at the expense of oxygenation of your heart muscle. Did you follow that now, what I'm saying to you? So what's going to happen when people need blood pressure medication and take more of it to control their systolic blood pressure and therefore have to push their diastolic blood pressure too low? What's going to happen to those people without oxygen returning to the heart? They're going to develop irregular heartbeats and sudden cardiac death. And then they have to put on drugs for atrial fibrillation now. Got to put on more drugs now. The atrial fibrillation was caused by the blood pressure medications. When you take blood pressure medications, they don't just increase your risk of cancer. They do, by the way, increase risk of cancer. Calcium channel blockers, one of the best blood pressure medications, have been shown in some studies after 10 years of use to double a woman's risk of developing breast cancer. Double the risk after 10 years of use. They're not without risk. First thing we learned in medical school, the first day I was there in pharmacology course, they said to us, medical students, don't forget that all drugs are toxic. You want to live in a manner to avoid the need for medicinal substances. Heard it once the first day, that was it. Are you hearing that? You want to live in a manner to avoid the need for medicinal substances. I don't think thyroid medication and insulin are toxic, but they're toxic in higher excessive dosing. But most medications are toxic even in low dosing, let alone the contaminated factors in medications that they also make them higher rates of cancer. But here's what I'm saying. I'm saying reduced diastolic blood pressure associated with more heart attacks. When you medicate your diastolic blood pressure below 60 with medication, you have 3 times the risk of heart attacks and dramatically increases the risk of irregular heartbeat. What I'm saying to you is excessive lowering of the blood pressure with medication is dangerous. It's not dangerous to have a diastolic of 60 when you're not on medication, because that's all the blood pressure is needed to get the blood back to the heart. Your body sets its own pressure to get the blood back that it needs. Because my blood vessels are youthful and elastic, and they're not occluded, it doesn't need for my diastolic to be high. It could be safe for me to have a diastolic of 70, but it's not good for me to medicate my blood pressure to 50. Nor would it be good if I had a high diastolic to medicate it to 70. You following this? Drugs, you don't get something for nothing. Drugs don't come without some negative aspect. You always get some negative aspect. Like beta blockers. They increase glucose intolerance, predispose you to diabetes. And They don't show mortality benefits for simple hypertension. A lot of confusing factors are going on here. There's some good factors and some bad factors, and you always get some bad actors mixed in there. When you have blood vessel disease, you've got fatty tissue in your blood vessels, and you've got fatty tissue on the outside of your blood vessels too. Is a drug going to take that fat off the outside wall of your blood vessel? Of course not. Is that blood vessel going to become elastic and youthful again with that fat built on there? Can you get a healthy blood vessel without losing weight? Of course not. This program has to be involved with losing weight, and the drugs make you gain weight. The diabetic medications make you gain weight. You see the skeleton, the cartoon of the fat on the interior wall of the blood vessel and the fat on the exterior wall of the blood vessel, and you got to take it off both places, right? Heart attacks. Here's a normal artery. The lumen is where the blood flows, the center of the pipe. There's an artery with vulnerable or juvenile plaque, the buildup of the cholesterol lipid core. You see the calcified cap between the edge of the lumen or the edge of the blood vessel lining and the cholesterol? How thin that is? A little thin lining of calcium. As that blood vessel moves, and as the lining of that blood vessel moves, that calcified cap could crack. And as that calcified cap cracks, like in that last picture, you can see the clot is formed, because when you expose the lipid core, the cholesterol exposed to the blood vessel, interior lumen, you're going to form a clot, and the clot's going to propagate and cause a heart attack. Let me say that one more time. That vulnerable plaque means that there's a lot of cholesterol in that plaque, and the calcified cap is thin, and the calcified cap covering the lipid core can move and crack. The newly laid down plaque is most dangerous. The newly laid down plaque has a thinner calcified cap. As the blood vessel disease, as the atherosclerotic plaque gets older in the more obstructive stable plaque, that's when it gets more calcified, gets infiltrated with smooth muscle and scar tissue, and it starts to occlude the lumen and shrink the space in the middle of the blood vessel, so you get chest pain. The blood vessels that cause chest pain have been there a long time. Those blood vessels have a thicker calcification protection between the soft cholesterol part, and they cause chest pain, but they don't cause heart attacks. The lesions, the blockages that are blocking the flow of blood are not the cause of heart attacks. It's the lesions that are there that are not interfering with the blood flow that are the most dangerous, causing the most heart attacks. When you do a stress test on a person and you identify those obstructive lesions that are causing chest pain, or you identify a region of the heart that's not getting enough blood flow to a blocked vessel, treating those long-standing calcified and obstructive plaques does not lower your risk of a future heart attack, because you're not treating, and you can't treat, the dangerous juvenile plaques that have been newly formed. That's why losing weight and gaining weight back again is so dangerous, and that's why there's more heart attacks around Christmas time and New Year's, when people binge on their diet. You go away on vacation, you come back, you gain weight. Or you go on vacation and you gain weight and you come back, or you go through the holidays and you gain weight. And you put weight on and you put on vulnerable plaque, and people have heart attacks. Whatever heart disease they had there is made more vulnerable by the rapid regain of weight. Don't go away to a health spa and eat healthy and come back and eat junk food and gain it back again. Don't improve your diet and then go out and binge and eat junk food. It's not going to help you, and it can hurt you. Why am I telling you this right now? Why am I showing you these pictures? I'm showing you these pictures to explain to you how worthless it is to put a stent in, because you're treating the obstructive plaques, and now you put a foreign body in the heart that can cause a clot, and you got to be on clot busting or blood thinning medications for the rest of your life, forever increasing your risk of hemorrhagic stroke or gastrointestinal bleed or having a clot in your heart because a stent is there, without removing the risk of heart attack, because treating those obstructive plaques does not lower your future risk of heart attack and does not make you live longer. And that's what the data shows. The data shows that when you're a stable patient and you put a stent in there, You're not living longer because of that stent. You're living shorter because of that stent. Medical care does not make you live longer. Now, of course, the caveat here is if a person's having a heart attack at the moment, if they're undergoing a heart attack, and they might even die, we got to put a stent in or to do something to allow the blood to flow through. That's a different story. That's an emergency use of a stent. We're talking about all these elective uses of stents where people are getting stress tests by the cardiologist, they're identifying lesions, and they try to identify lesions, they try to justify it by, oh, that lesion's like 100% obstructed, or that's obstructed in the widowmaker, or that's such a dangerous, that's the LAD obstruction. That needs a stent, that needs a stent. But you know what? It's not true. I take care of these same patients that are told they need an emergency stent by these cardiologists, and they get well. And I have now friends of mine who are invasive cardiologists who are sending me these very, very sick people who are getting well. And we even open up vessels that are 100% obstructed to develop collaterals, start to get more flow. And it's amazing the miraculous healing that occurs when the dietary excellence is tuned up to such a high degree. The most advanced cases get well. And what I'm saying here is you go to a doctor, a cardiologist, you get evaluated by a stress test, he has an abnormal stress test and tells you have a blockage there and you're high risk of heart attack that you have to treat. And his treatment doesn't help you. Doing the stress test, the cardiac catheterization, the angiogram, and then the stent placement did not make you live longer. What if he gave you the stress test or the cardiac CT and it showed you that you didn't have an obstructive lesion, or you didn't have a lot of calcifications? Does that mean you're okay, you're not going to have a heart attack the next day or the next week or the next month? No, it means nothing. Because vulnerable plaque or juvenile plaque, the most dangerous type of plaque, is invisible to cardiovascular testing. Do you get that? If it's invisible and you can't show it up on a stress test or a coronary CT, then how do we know if you're healthy or not? How can we figure that out? Well, it's simple. It's really simple. You're a normal body weight. You eat a super healthy diet. Your cholesterol's naturally low without medication. Your blood pressure is great with no medication needs, and you have good physical fitness and exercise tolerance. And your waist measurement is good, and your blood pressure is good. You're in control. You don't need any magical and mystical and high-tech evaluations. You need to take charge of your health and get yourself in good, and do what you have to do to get well. Because you can't get well from your doctor can't make you well. Only you can make you well. You know what they say? I guess that's Yogi Bear. Only you can prevent forest fires.